Yo, what's up, guys? Welcome back to the nursing channel. My name is Sam, and today I'm gonna talk to you about nursing case management and the things you should know before you get into nursing case management. I know a lot of nurses are trying to stray away from doing direct patient care, from being at the bedside. They want to go over to something different, something that's less risky, um, where you're not, around all the coughing, where you're not around bodily fluids, and you're not at risk. As you guys know, the COVID-19 coronavirus is going everywhere and it's spreading rapidly. And so a lot of frontline nurses, the ones doing the bedside care, are kind of reconsidering whether they can go a different career path, because nobody wants to get sick, nobody wants to get the coronavirus. We all have families, we all have friends that you want to continue to spend time with, and I understand that. And so nursing case management is definitely a good alternative. It's definitely a good option. And today I'm going to talk to you guys about some things that you should know before you get into nursing case management. Number one is make sure you work on your communication skills. Because communication is key as a nurse case manager, okay? Know how to talk with people, socialize with them in a professional way, be direct with them, but also be respectful. Don't get upset or angry. Just let people know like what the situation is. This is what we tried to do in the situation, and this is what we're waiting for. For example, let's say a patient came into the hospital. They're newly diagnosed with COPD, chronic obstructive pulmonary disease, and the patient needs oxygen to go home. And so as a nurse case manager, your job is to make sure that the patient's home oxygen gets delivered to the patient, because they can't go home without oxygen. They go home, they don't have any oxygen, they're going to get short of breath, their oxygen saturations are going to decline, and then what's going to happen? They're going to call 911, and they're going to come back straight to the hospital again to get readmitted. So those are things that we want to avoid as case managers or discharge planners. So your job is to make sure that we get a vendor that's willing to deliver an oxygen machine to the patient. Okay, so your job as a nurse case manager is to ensure that. Also, your job as a nurse case manager is to screen the patient. Okay, what is the patient's address? Because we want to make sure that we tell the vendor, hey, deliver the piece of oxygen equipment over to this address. The patient lives here. And then you want to make sure that the patient has a family member or friend at the house that can receive the piece of oxygen equipment. Okay? So these are little things that you have to make note of as a case manager. All right? Also, how's the patient going to go home? They need to be on oxygen. The doctor wants them to be on 2 liters of oxygen continuously. How are they going to go home? They don't have any oxygen to go home with, at least during the ride home. So you have to think about things. Should we order an ambulance for the patient so that they can get oxygen administered until they get home, and then they get access to their home oxygen? Okay? Is the patient going to have any portable tanks? Talk to the vendor. Let them know, hey, are you guys going to deliver a home concentrator and portable tanks to the patient's home? Or can you deliver the portable tanks to the hospital bedside, and then the home concentrator to the patient's home? That way the patient can go with their family member with the portable tanks, get home, and then have access to their home oxygen concentrator. Okay, so these are questions. This is the way you're supposed to think as a nurse case manager. Okay, so first thing as a nurse case manager is have good communication with your patients, with the doctor, with the medical staff. Don't be afraid to tell the doctor, hey, we found a vendor for the patient that can deliver the home oxygen concentrator. However, they cannot deliver today, we'll have to delay discharge until tomorrow morning. We'll follow up with the vendor to make sure that they can deliver the oxygen concentrator at that time. Okay, don't be afraid to tell the doctor what's going on. Okay, as a nurse case manager, you are in a leadership position. Okay, you are coordinating the discharge side of things. Okay, most important is, okay, yeah, maybe the patient will remain in the hospital one more day. It's going to be inconvenient. Yeah, it can be expensive to keep a patient in the hospital for one more day, even though they're medically stable. But the most important thing is the patient's safety. You don't want to send that patient home without oxygen. Okay, next thing is, as a nurse case manager, is screen all your patients. Do what's called a discharge assessment. Go and talk to your patients, print out their face sheet and make sure that all their demographic information is correct. Verify that the patient has a primary care doctor. Verify the patient's home address. Verify who the patient lives with. Do they have any support at home? Verify, does the patient live in a single level home or multi-story level home? Why is this important? A patient comes into the hospital, just recently came out of hip surgery or knee surgery. They're stable to just get discharged to home, and they get home, the bathroom's on the second floor. Are they going to be able to walk those stairs to get to the bathroom? Or should they be discharged to a skilled nursing facility? You have to, this is the way you should be thinking as a nurse discharge planner / case manager. Also, another thing is get familiar with insurances, okay? Most importantly, get familiar with Medicare. Know what Medicare Part A is and Medicare Part B. Why is this important? Patient gets assessed by physical therapy. Patient just got out of a recent hip surgery and is making a little bit of progress, but they're not back to their baseline. They're not ambulating like they should be at their baseline. So they're not quite ready to go home yet, but they're medically stable from a hospital standpoint. So what should you do then? Physical therapy is going to be like, hey, Sam, the patient is ready to be discharged. However, I don't think they're safe to go home. They're going to need to be discharged to a facility where they have 24-hour care and support, and they can continue to work with physical therapy. We're recommending the patient goes to a skilled nursing facility. All right, that's where you come in. All right, you're going to send out referrals for the patient to the different skilled nursing facilities in the patient's area. Obviously, talk to the patient, see if they have a preference, and you're going to wait and see until one of the skilled nursing facilities responds and is able to accept the patient. Okay, why do you need to get familiar with Medicare Part A and Part B? Because if the patient has Medicare and that's their primary insurance, and specifically Medicare Part A, the patient is part of the criteria for the patient to get admitted into a skilled nursing facility is they have to be admitted under inpatient status, meaning when the patient gets admitted, they have to have an inpatient banner, not observation, inpatient. And the patient is supposed to remain in the hospital for at least 3 midnights in order to qualify to get accepted into a skilled nursing facility. Okay? I don't make the rules up. That's just the way Medicare works. Okay? Medicare Part A will pay for the patient's stay at a hospital. Medicare Part A will also pay for a patient's stay at a skilled nursing facility. So if the patient asks you, well, I don't have money to pay for my stay at a skilled nursing facility, don't worry, you have Medicare Part A. Medicare Part A will cover up to 80% of your stay at the skilled nursing facility, sometimes even higher. But it's also very important that the patient has a secondary insurance. So if they have Medi-Cal as a secondary, most likely their stay will get completely covered. So this is some information that you should know as a new nurse case manager. Also, another piece of advice: take care of your nurse case management assistants. As a nurse case manager, you're going to have an assistant, a case management assistant. Make sure you take care of them, you treat them respectfully. You love them, you cherish them, because they will make your job easier. Usually it's the case management assistants that are communicating with the vendors, okay? And the home health agencies, and yeah. So usually they'll just keep you updated with regards to finding a skilled nursing facility, whether we have a vendor for the home oxygen, whether we found a home health agency. So yes, take care of them, take care of them and appreciate them. Anyways, this is my video for all you new nurse case managers. Hope this helps, and if you guys have any questions, feel free to ask a question in the comment section. I will talk to you guys later. Take care.